Hello and welcome. You've probably heard the buzz. New medications that are helping people lose significant weight and manage their diabetes like never before. Names like Ozempic, Wegovy, or Mounjaro. They're all over the news and social media. But what exactly are these drugs? How do they work? Are they even safe? And what's the real story behind this medical revolution? Today, this presentation will dive deep into the world of GLP-1s. We'll explore the science, the history, the benefits, the risks, and the incredible impact these drugs are having on medicine and society. So, let's get started. To begin, let's understand the fundamentals. What exactly is this GLP-1 that everyone is talking about? GLP-1 stands for glucagon-like peptide. It's a naturally occurring hormone produced in our bodies, specifically in the gut by cells called enteroendocrine cells, particularly after we eat a meal. Think of it as one of the body's key managers for food processing. Its primary role is to help regulate blood sugar levels, especially in response to the nutrients we consume. This makes it a type of hormone known as an incretin. So, what then are GLP-1 medications? These are a class of drugs technically named glucagon-like peptide, 1 receptor agonists. For simplicity in our discussion, we'll refer to them as GLP-1s. The term agonist is key here. It means these medications are designed to mimic the action of our natural GLP-1 hormone. They bind to and activate the same receptors in the body that our own GLP-1 would. Essentially, they perform the functions of natural GLP-1, but often with a more potent or a longer-lasting effect. This approach of enhancing a natural bodily process is a common strategy in drug development, as it works with the body's existing systems, which can often lead to more targeted and effective therapies. These medications have two main approved uses. Firstly, they are a significant tool in the treatment of type 2 diabetes mellitus, often abbreviated as T2DM. They help individuals with T2DM achieve better control over their blood sugar levels. Secondly, and this is where much of the recent public attention has been focused, GLP-1s are increasingly recognized and approved for managing obesity and aiding weight loss. They are prescribed for individuals with obesity or for those who are overweight and have other weight-related health conditions. It's important to note that while highly effective, GLP-1s are among several pharmacological options available for these endocrine diseases. The fact that this single class of drugs can address both type 2 diabetes and obesity is particularly noteworthy because these two conditions are often closely linked, sometimes referred to collectively as diabesity. A medication that can tackle both simultaneously offers a more integrated treatment approach for many patients, contributing significantly to their current prominence and the rapid growth in their use. A journey through time, the discovery and history of GLP-1s. The story of GLP-1s is a fascinating journey of scientific discovery that spans several decades. It didn't start with GLP-1 itself, but with an intriguing observation known as the incretin effect. Scientists noticed that when glucose was administered orally, it prompted a much more robust insulin response compared to when the same amount of glucose was given intravenously. This suggested that the gut must be releasing substances, incretins, that enhance insulin secretion. This concept led to the characterization of the first incretin peptide in the 1970s, glucose-dependent insulinotropic polypeptide, or GP. It was isolated from porcine gastric extracts and was an important first step in understanding these gut hormones. The specific hormone GLP-1 came into focus later. Its sequence was identified following the cloning of glucagon cDNAs and genes. It wasn't until 1984 that the first GLP-1 was officially discovered, and interestingly, there was little initial excitement surrounding this finding. However, subsequent research soon demonstrated that GLP-1 had a powerful ability to potentiate, or increase, glucose-dependent insulin secretion. This effect was observed in isolated cells, in animal models, and importantly, in humans. A pivotal moment in the development of GLP-1s as therapies came with a crucial distinction between GLP-1 and GIP. Researchers found that the insulin-stimulating actions of GLP-1 were relatively well preserved in individuals with type 2 diabetes, whereas the effects of GP were often diminished in these patients. This was a game-changing observation because it suggested that GLP-1-based therapies could be particularly effective for T2DM, and it directed significant research attention and funding towards developing GLP-1 medications. Consequently, the initial applications and research efforts for these drugs focused primarily on diabetes treatment. The culmination of this early research was the first FDA approval for a GLP-1 medication. In 2005, Byetta, with the active ingredient exenatide, was approved for the treatment of type 2 diabetes. This was a major milestone, marking the arrival of a new class of diabetes drugs. Following Byetta's approval, the field continued to evolve. Over the subsequent years, more GLP-1s were developed, including formulations that were longer-acting, allowing for less frequent injections. The scientific journey also revealed more about GLP-1's functions. The connection between GLP-1 and reduced food intake became clearer, which spurred the development and eventually the approval of the first GLP-1 specifically for obesity. This was liraglutide, marketed as Saxenda, approved in 2014 for weight management. Furthermore, starting around 2016, large-scale clinical trials began to demonstrate significant cardiovascular benefits associated with these medications, further expanding their therapeutic profile. This progression from a basic scientific discovery through initial skepticism to a multi-billion-dollar drug class treating multiple conditions underscores how persistent research and key differentiating findings can lead to major medical breakthroughs over time. The applications expanded from diabetes to obesity and then to cardiovascular protection, showing how continued investigation can unlock broader therapeutic potentials. The science unpacked. How do GLP-1s work? So, how exactly do these GLP-1 medications exert their powerful effects on blood sugar and body weight? It's not just one single action. They work through a multifaceted mechanism, influencing various processes in the body simultaneously. Let's break down these key actions. First, and perhaps most well-known, is their effect on insulin. GLP-1s stimulate the pancreas to release more insulin. Critically, this insulin release is glucose-dependent, meaning it primarily happens when blood sugar levels are elevated, such as after a meal. This is a very important feature because it makes GLP-1s less likely to cause hypoglycemia or dangerously low blood sugar when used on their own, compared to some older diabetes medications that can lower blood sugar regardless of its current level. This smart mechanism helps maintain a more stable blood sugar profile. Second, GLP-1s help to reduce the amount of glucagon in the bloodstream. Glucagon is another hormone produced by the pancreas, but it has the opposite effect of insulin. It signals the liver to release stored glucose into the blood. By inhibiting glucagon secretion, GLP-1s prevent an unnecessary release of sugar from the liver, further contributing to lower blood sugar levels. Third, these medications slow down gastric emptying. This means they reduce the speed at which food moves from the stomach into the small intestine. When digestion is slower, the sugar and other nutrients from food are absorbed into the bloodstream more gradually. This helps to prevent the sharp spikes in blood sugar that can occur after meals, particularly in individuals with diabetes. A secondary effect of slowed stomach emptying is that it can also contribute to a feeling of fullness, making a person feel satisfied with less food and for a longer period. Fourth, and this is particularly crucial for their weight loss effects, GLP-1s act on the brain to regulate appetite and food intake. The GLP-1 hormone and its mimics can cross into the brain and interact with receptors in areas that control hunger and satiety. They effectively curb hunger and increase feelings of fullness. More specifically, research has shown that GLP-1 can directly stimulate neurons known as PONC/CART neurons, which are associated with reduced appetite, and inhibit other neurons called NPY/AGRP neurons, which typically increase appetite. While the precise intricacies of these brain mechanisms are still an active area of research, it's clear that the central nervous system plays a vital role in how GLP-1s lead to reduced food intake and subsequent weight loss. Early studies, such as those by Flint and colleagues, demonstrated that infusing GLP-1 into healthy human volunteers increased their sensations of fullness and satiety, leading them to eat less. These combined actions, enhancing glucose-dependent insulin release, suppressing glucagon, slowing digestion, and reducing appetite via the brain, create a powerful synergistic effect for improving metabolic control. It's this comprehensive approach that makes GLP-1s so effective for both managing type 2 diabetes and promoting weight loss. However, it's also worth noting that the mechanism of slowed gastric emptying, while beneficial, is likely a primary contributor to some of the common gastrointestinal side effects, such as nausea, that can be experienced with these medications. Meet the medications, an overview of common GLP-1s. The family of GLP-1 medications has been growing, with several options now available and more in development. Let's look at some of the key approved GLP-1s, including some brand names that you might recognize. One of the most talked about is semaglutide. It's available as Ozempic, a once-weekly injection primarily approved for type 2 diabetes, but also widely known for its weight loss effects. Wegovy, this is also semaglutide, but typically at a higher dose, and it's specifically approved as a once-weekly injection for chronic weight management. Rybelsus, this is a pill form of semaglutide, taken once daily, approved for type 2 diabetes. The development of an oral option, like Rybelsus, marked a significant step towards patient convenience. Another well-established GLP-1 is liraglutide, Victoza, a once-daily injection for type 2 diabetes. Saxenda, like Wegovy for semaglutide, Saxenda is liraglutide at a higher dose, administered as a daily injection, and approved for chronic weight management. Then there's selaglutide, Trulicity. This is a once-weekly injection for type 2 diabetes, which also often supports moderate weight loss. Exenatide was one of the pioneers in this class. Byetta, an earlier GLP-1, administered as a twice-daily injection. Bydureon Bicis, a longer-acting, once-weekly injectable form of exenatide. A newer and highly effective medication is tirzepatide. This one is a bit different. Mounjaro, a once-weekly injection approved for type 2 diabetes, which has shown very significant weight loss results. Zepbound, this is the same molecule as Mounjaro, tirzepatide, also a once-weekly injection, but specifically approved for chronic weight management. The key difference with tirzepatide is that it's a dual-acting agonist. It targets not only the GLP-1 receptor, but also the GIP, glucose-dependent insulinotropic polypeptide, receptor. This dual action appears to contribute to its enhanced efficacy, particularly for weight loss, representing an evolution beyond single GLP-1 receptor targeting. Most of these medications are administered as subcutaneous injections, a shot given just under the skin. The frequency varies from twice daily for some older versions to once daily or, increasingly common, once weekly for newer agents. As mentioned, oral options like Rybelsus are available and more are anticipated, which could further improve ease of use. This landscape of different active ingredients being marketed under various brand names, sometimes for different indications, diabetes versus weight management, and at different dosages, can be confusing. For example, semaglutide is the active ingredient in Ozempic for diabetes and Wegovy for weight loss. This is often a marketing and regulatory strategy, but highlights the importance of discussing this specific medication and its intended use with a healthcare provider. The development pipeline also points towards even more sophisticated approaches, such as triagonists like retatrutide, which targets GLP-1, GIP, and glucagon receptors, potentially offering even greater metabolic benefits. This continued innovation underscores the dynamic nature of this field and the ongoing quest for more convenient and potent therapies. The evidence: efficacy for weight loss and diabetes control. Now, let's delve into what the clinical evidence says about how well these GLP-1 medications work. As a class, GLP-1s have demonstrated high effectiveness for both managing type 2 diabetes and promoting weight loss. For individuals with type 2 diabetes, these drugs significantly lower blood sugar levels. A key measure of long-term glucose control is HbA1c, or A1c, and GLP-1s have been shown to produce substantial reductions in A1c. When it comes to weight loss, the results can be quite remarkable, especially with the newer agents and when used at doses specifically approved for weight management. The amount of weight loss achieved can vary depending on the specific medication and the dosage prescribed. It's also important to remember that these medications are typically studied as an adjunct to diet and exercise, meaning they work best when combined with lifestyle modifications. Let's spotlight some key clinical trial results explained in a way that's easy to understand. First, consider liraglutide, marketed as Saxenda for weight management. The SCALE Obesity and Prediabetes trial, published in the New England Journal of Medicine, was a landmark study. In this trial, participants received either 3 milligrams of liraglutide daily along with diet and exercise counseling, or a placebo with the same counseling. After 56 weeks, the results were compelling. The liraglutide group lost an average of 8.4 kilograms, which is about 18.5 pounds. In contrast, the placebo group lost an average of 2.8 kilograms, or about 6.2 pounds. A significantly higher percentage of patients in the liraglutide group achieved meaningful weight loss thresholds. For instance, 63.2% of those on liraglutide lost at least 5% of their body weight, compared to only 27.1% in the placebo group. Furthermore, 33.1% of the liraglutide group lost more than 10% of their body weight, versus just 10.6% in the placebo group. This trial was important as it was one of the earlier large studies clearly demonstrating substantial weight loss with a GLP-1 specifically dosed for obesity. A weight loss of 5 to 10% is generally considered clinically significant for improving health. Next, semaglutide, marketed as Wegovy for weight management, has been studied extensively in the STEP, semaglutide treatment effect in people with obesity, program trials. These trials consistently showed impressive weight loss. For example, in studies like STEP 1, once-weekly semaglutide at a 2.4 milligrams dose often resulted in average weight loss in the range of 15% to 17% of initial body weight. Semaglutide is generally considered one of the most effective GLP-1s for weight loss. Then we have tirzepatide, the dual GLP-1 and GIP agonist, marketed as Mounjaro for diabetes and Zepbound for weight management. Its efficacy has been demonstrated in the SURPASS trials for type 2 diabetes and the SURMOUNT trials for obesity. The SURPASS trials showed strong A1C reductions and significant weight loss in patients with type 2 diabetes. The SURMOUNT trials focused on obesity. A particularly interesting study is SURMOUNT-5, which was a head-to-head comparison against semaglutide, with results published in the New England Journal of Medicine. This trial enrolled adults with obesity but without diabetes and compared tirzepatide, Zepbound, to semaglutide, Wegovy, over 72 weeks. Tirzepatide demonstrated superior weight loss. The mean percent change in body weight from baseline was minus 20.2% for the tirzepatide group, compared to minus 13.7% for the semaglutide group. A greater proportion of patients taking tirzepatide achieved higher weight loss thresholds of at least 10%, 15%, 20%, and even 25% of their initial body weight compared to those on semaglutide. The results from trials like SURMOUNT-5 are critical because they provide comparative effectiveness data helping clinicians and patients understand potential differences between these powerful medications. The findings suggest that tirzepatide, with its dual agonist mechanism, may offer an even greater degree of weight loss for many individuals. This evidence underscores that not all GLP-1s provide the same degree of weight loss, and higher doses generally lead to more significant results. The consistent finding of clinically meaningful weight loss across multiple trials for various GLP-1s highlights their transformative potential in managing obesity as a chronic disease. More than just weight and sugar. Other health benefits. While the effects of GLP-1s on blood sugar and body weight are remarkable, their benefits don't stop there. A growing body of research indicates these medications can have positive impacts on other aspects of health, showcasing what scientists call pleiotropic effects, meaning they affect multiple organ systems. One of the most significant areas is cardiovascular health. Several studies have found that certain GLP-1s can lower the risk of serious cardiovascular events such as heart disease, heart attacks, and strokes. These benefits have been particularly prominent in individuals with type 2 diabetes who also have established cardiovascular disease. The first large cardiovascular outcome trials, or CVOTs, demonstrating these protective effects for long-acting GLP-1s in T2D patients began to emerge around 2016. These trials were pivotal, as showing a reduction in such major events is a high bar for any medication. More recently, these cardiovascular benefits have been seen to extend to people with obesity, and even to individuals suffering from a specific type of heart condition called heart failure with preserved ejection fraction, HFpF. Additionally, many people taking these medications also experience improvements in their blood pressure, which is a key risk factor for heart disease. Beyond the heart, GLP-1s have shown kidney protective effects. Some of these medications can help preserve kidney function and may slow the progression of diabetic kidney disease, DKD, a common and serious complication of diabetes. The success of GLP-1s in diabetes and obesity has spurred research into other potential applications, leading to a cascade of new findings. Several emerging areas of research are showing promise. Liver health. There's growing interest in their role in treating metabolic dysfunction-associated steatohepatitis, MASH, formerly known as non-alcoholic steatohepatitis, NASH. MASH is a severe form of fatty liver disease that can lead to cirrhosis and liver failure. A recent Phase 3 trial, with results published in the New England Journal of Medicine, found that once-weekly semaglutide at a 2.4 milligrams dose led to improved liver histologic outcomes, meaning actual improvements in the liver tissue, in patients with MASH who had moderate or advanced liver fibrosis. This is a very encouraging development, as MASH is a growing global health concern, and this research suggests GLP-1s might actually modify the disease process in the liver. Neurodegenerative diseases. There is evidence from animal studies that GLP-1s possess neuroprotective properties. Clinical trials have explored their use in conditions like Parkinson's disease. For instance, a trial with exenatide showed some modest improvements in Parkinson's symptoms, although more extensive research is needed to confirm these effects. Currently, GLP-1s are being studied in Phase 3 trials for their potential benefits in both Parkinson's disease and Alzheimer's disease, offering hope for new therapeutic avenues in these challenging conditions. Sleep apnea. Obstructive sleep apnea, OSA, is common in individuals with obesity. Tirzepatide, under the brand name Zepbound, has recently gained approval for treating moderate to severe OSA in obese patients. Clinical trial data showed that tirzepatide led to significant reductions in the apnea-hypopnea index, a key measure of sleep apnea severity. Peripheral artery disease, PAD. This condition, which affects blood flow to the limbs, is also an area where GLP-1s are currently being studied for potential benefits. These expanding applications highlight that the GLP-1 pathway likely plays a fundamental role in overall metabolic health and inflammation, far beyond just glucose and weight regulation. This ongoing discovery process continues to broaden our understanding of the therapeutic potential of this remarkable class of drugs. Understanding the risks, side effects, and safety considerations. While GLP-1 medications offer significant benefits, like all effective drugs, they also come with potential side effects and safety considerations that are important to understand. The powerful mechanisms that make them effective can also contribute to their side effect profile. The most common side effects are generally gastrointestinal in nature. These can include nausea, vomiting, diarrhea, constipation, abdominal pain. Some individuals may also experience decreased appetite, which can be a desired effect for weight loss, but is also listed as a side effect, dyspepsia or indigestion, and with some specific drugs like Zepbound, symptoms such as eructation, belching, hair loss, and gastroesophageal reflux disease (GERD) have been reported. These side effects are often dose-dependent, meaning they can be more pronounced at higher doses. They frequently occur when starting the medication or when the dose is increased, and for many people, they tend to lessen or resolve over time as the body adjusts. Injection site reactions, like redness or discomfort at the injection spot, can also occur for the injectable forms. Beyond these common issues, there are more serious warnings and precautions that regulatory agencies like the FDA highlight in the prescribing information for these drugs. It's crucial to be aware of these. Risk of thyroid C-cell tumors. Studies in rodents showed that GLP-1s could cause a type of thyroid tumor called C-cell tumors. It is currently unknown if this risk applies to humans, as the relevance of the animal findings is not fully established. However, as a precaution, these medications are contraindicated, meaning they should not be used in patients with a personal or family history of medullary thyroid carcinoma, MTC, which is a specific type of thyroid cancer, or in patients with a rare condition called multiple endocrine neoplasia syndrome type 2, MEN2. Patients are advised to be aware of symptoms of thyroid tumors, such as a lump or swelling in the neck, difficulty swallowing, or persistent hoarseness, and to report these to their doctor. Pancreatitis. Inflammation of the pancreas. Cases of acute pancreatitis have been observed or reported in patients treated with GLP-1s. If pancreatitis is suspected, typically indicated by severe abdominal pain that may radiate to the back, the medication should be discontinued promptly and medical attention sought. Acute gallbladder disease. Problems such as cholelithiasis, gallstones, or cholecystitis, inflammation of the gallbladder, have occurred in some patients. Symptoms might include pain in the upper abdomen, fever, or jaundice. Hypoglycemia. Low blood sugar when GLP-1s are used alone. The risk of hypoglycemia is generally low due to their glucose-dependent mechanism of action. However, this risk increases significantly if they are used in combination with other medications that also lower blood sugar, such as insulin or a class of drugs called sulfonylureas. In such cases, the dose of the other diabetes medication may need to be reduced. Acute kidney injury. There have been reports of acute kidney injury, sometimes requiring hospitalization. This can occur if severe gastrointestinal side effects like nausea, vomiting, and diarrhea lead to dehydration and reduced kidney function. Monitoring kidney function is important, especially for patients with pre-existing kidney disease or those experiencing severe GI reactions. Hypersensitivity reactions. Serious allergic reactions, such as anaphylaxis, a severe whole-body reaction, or angioedema, swelling, often of the face, lips, or tongue, can occur, although rarely. If an allergic reaction is suspected, the drug should be stopped immediately and medical help sought. Diabetic retinopathy complications. In some clinical trials involving patients with type 2 diabetes, who also had a history of diabetic retinopathy, eye damage from diabetes, a worsening of this condition was reported. Therefore, patients with a history of diabetic retinopathy should be monitored regularly while on these medications. Severe gastrointestinal disease. GLP-1s are generally not recommended for patients who already have severe gastrointestinal conditions, such as severe gastroparesis, a condition where the stomach empties too slowly. Suicidal behavior and ideation. For some GLP-1s approved for weight management, like Zepbound, the prescribing information includes a warning to monitor for depression or suicidal thoughts, and to discontinue the medication if such symptoms develop. The FDA has evaluated reports of suicidal thoughts or actions across the GLP-1 class and, as of January 2024, their reviews of clinical trials and observational studies did not find a direct association between the use of GLP-1s and the occurrence of suicidal thoughts or actions for the class as a whole. However, this warning remains in place for certain obesity medications as a precautionary measure. Pulmonary aspiration during anesthesia. There have been reports of food or liquid getting into the lungs, pulmonary aspiration, in patients receiving GLP-1s who are undergoing surgery or procedures requiring anesthesia or deep sedation. Patients should inform their healthcare providers they are taking a GLP-1 before any scheduled surgery. Pen sharing. For injectable GLP-1s that come in multi-dose pens, it's crucial to never share a pen between patients, even if the needle is changed, to prevent the risk of infection. This list of potential risks underscores the importance of using these medications under strict medical supervision. They are prescription drugs for very good reasons. Self-medicating or using them without a doctor's guidance can be dangerous. Furthermore, due to the high demand, cost, and sometimes limited supply of approved GLP-1s, there are significant concerns about unapproved or compounded versions. The FDA has issued warnings against using these. There have been multiple reports of adverse events, some serious enough to require hospitalization, linked to dosing errors with compounded injectable semaglutide products. These errors can result from patients mismeasuring doses or healthcare professionals miscalculating them. Compounded versions might also use different salt forms of the active ingredients, like semaglutide sodium or semaglutide acetate, for which the safety and efficacy are unknown and not approved by the FDA. There's also a risk of encountering counterfeit products or products illegally sold and falsely labeled for research purposes only. Therefore, it is always essential to obtain these medications through a prescription from a licensed healthcare provider and have that prescription filled at a state-licensed pharmacy. It's also important to recognize that individual responses to these medications, both in terms of benefits and side effects, can vary significantly. What works well for one person with minimal side effects might be different for another. Understanding these risks allows for a more informed conversation with a healthcare provider about whether a GLP-1 medication is an appropriate and safe choice. The booming market and the future pipeline. The advent and success of GLP-1 medications have created nothing short of a phenomenon in the pharmaceutical world, leading to an explosive market growth and an intense race for future innovations. The global market for GLP-1s is expanding at a staggering pace. Current estimates for 2024 to 2025 place the market size anywhere from approximately $49.3 billion to $62.86 billion US. Projections for the next decade by 2034 or 2035 suggest this market could soar to between $157.5 billion and $268.37 billion US. This translates to a very high compound annual growth rate, CAGR, estimated to be between 11.1% and 17.5%. This rapid expansion is primarily driven by the rising global prevalence of type 2 diabetes and obesity, coupled with ongoing research and development activities and significant financial investments in this drug class. While type 2 diabetes treatment currently holds the largest share of this market, the obesity segment is growing very rapidly and is expected to claim a significant portion in the coming years. Contributing to this is the projection from the World Obesity Atlas that over 4 billion people, which is 51% of the global population, may be affected by obesity by the year 2035. Several key pharmaceutical players are at the forefront of this market. Novo Nordisk is a major manufacturer, responsible for well-known GLP-1s like Ozempic, Wegovy, Rybelsus, Victoza, and Saxenda. To give a sense of scale, sales of Ozempic alone crossed $13.9 billion in 2023. Eli Lilly is another dominant force, producing Mounjaro, Zepbound, and Trulicity. Their dual agonist drugs Mounjaro and Zepbound achieved sales exceeding $6 billion in their first quarter on the market, highlighting the immense demand. Other established pharmaceutical companies like AstraZeneca, with Byetta and Bydureon, and Sanofi, with Adlixin and Soliqua, also have GLP-1 products. This intense competition among pharmaceutical giants is fueling rapid innovation and substantial R&D investment as companies vie for market leadership. The innovation isn't slowing down. In fact, the future pipeline for GLP-1s is bustling with next-generation candidates aimed at improving efficacy, convenience, and tolerability. Oral formulations. While most GLP-1s are injectable, the demand for oral options is high. Beyond Rybelsus or semaglutide, several other oral GLP-1s are in late-stage clinical development. Examples include Eli Lilly's orforglipron and Novo Nordisk's amycretin, which is also an amylin agonist. The oral route of administration is predicted to be the fastest-growing segment within the GLP-1 market, potentially expanding patient access significantly. Longer-acting injectables. There's a continuous push towards less frequent dosing to improve patient adherence and convenience. Research is underway for once-monthly injections. For instance, Camurus is trialing a once-monthly version of semaglutide, and companies like Amgen are developing new once-monthly molecules like MariTide. Strategic deals, such as those between Lilly and Camurus or Novo Nordisk and Ascendis, are focused on developing these longer-acting formulations. Dual and triple agonists. Building on the success of tirzepatide, a dual GLP-1/GP agonist, the pipeline is rich with molecules that target multiple hormone receptors simultaneously. Retatrutide, from Eli Lilly, is a notable example of a triple-action injectable that targets GLP-1, GP, and glucagon receptors. Early studies suggest it may lead to even more significant weight loss. Survodutide is another promising compound in development. The triagonist segment is expected to grow at a particularly high rate, suggesting a shift towards multi-targeting strategies for enhanced efficacy. Combination therapies. Another approach involves combining GLP-1s with other types of metabolic drugs. Novo Nordisk's CagriSema is a fixed-dose combination of cagrilintide, an amylin analog, and semaglutide. Their candidate amycretin is a unimolecular GLP-1 and amylin receptor coagonist, which reportedly outperformed Wegovy in an early Phase 1 study. Focus on new indications. Research continues to expand the potential uses of GLP-1s beyond type 2 diabetes and obesity. Active investigations are ongoing for conditions like MASH/NASH, liver disease, Alzheimer's disease, Parkinson's disease, peripheral artery disease, and diabetic kidney disease. However, this boom comes with manufacturing and supply chain challenges. The surging demand has frequently led to shortages and has put immense pressure on manufacturing capabilities. Producing these peptide-based drugs is a complex process, often involving solid-phase peptide synthesis, SBPS. Key challenges include the use of enormous volumes of solvents, which are costly, can be hazardous, pose environmental concerns, and necessitate complex, specialized manufacturing facilities. The need for specialized equipment, such as corrosion-resistant vessels to handle aggressive chemicals like trifluoroacetic acid, TFA. The inherent difficulty in scaling up peptide synthesis to meet global demand. Innovations in manufacturing are therefore crucial. These include exploring aqueous-based peptide synthesis, using water-based systems instead of harsh solvents, developing solvent recovery strategies, implementing continuous chromatography for purification, and the broader shift towards oral tablet formulations, which can simplify some aspects of production and distribution. The packaging demands are also evolving, with specific requirements for auto-injectors, refrigeration for many products, and robust cold chain logistics, to ensure the medications remain stable from factory to patient. These manufacturing and supply considerations are critical bottlenecks that need to be addressed to fully realize the potential of GLP-1 therapies. The bigger picture, societal impact and ethical questions. The rise of GLP-1 medications is not just a medical story, it's a societal one, with far-reaching impacts on culture, industry, and ethics. These powerful tools are reshaping how we think about weight, health, and treatment. One significant area of impact is on diet culture, body image, and weight stigma. GLP-1s are being aggressively marketed and widely discussed for their weight loss effects. This can inadvertently reinforce societal pressures for thinness and existing narratives within diet culture. Social media platforms are often saturated with idealized body types and rapid weight loss trends, and the availability of these drugs can fuel comparisons and pressure to conform, while some public health initiatives promote a holistic view of well-being. Others may frame body weight as the primary or defining marker of health, which can perpetuate harmful ideas that thinness is inherently superior. There's a concern that these medications might be viewed as a simple medical solution to body size, which could, in turn, reinforce weight stigma, that is, discrimination or negative bias directed towards people based on their body size. Weight stigma is already a pervasive issue, evident in employment, education, and media portrayals, and it can lead to significant psychological harm, including low self-esteem and internalized shame. Some fear these drugs might be perceived by some as an easy way out, further stigmatizing individuals who use them or who struggle with weight. On the other hand, for many individuals, these medications represent a legitimate and much-needed medical tool to manage obesity, which is recognized as a chronic disease. This creates a complex dilemma: how to provide effective medical treatment without inadvertently bolstering harmful societal pressures. Closely related are concerns regarding eating disorders. The primary mechanisms of GLP-1s, appetite suppression and rapid weight loss, can be particularly challenging or even triggering for individuals who are at risk of, currently struggling with, or recovering from eating disorders. These drugs can blur natural hunger and fullness cues, make structured eating more difficult due to side effects like nausea or prolonged fullness, and unintentionally validate restrictive eating patterns. The impact can vary depending on the type of eating disorder. For those with restrictive eating disorders like anorexia nervosa, the appetite suppression and weight loss can increase the risk of malnutrition, dangerous electrolyte imbalances, and other severe complications. For individuals with binge eating disorder or bulimia nervosa, while GLP-1s might temporarily reduce binge episodes due to reduced appetite, they do not address the underlying emotional or psychological triggers. In fact, the appetite suppression could potentially worsen this cycle of restriction and binging. For those engaging in purging behaviors, the nausea and stomach pain, sometimes caused by the slowed stomach emptying effect of GLP-1s, might inadvertently lead to an increase in purging behaviors like vomiting or a laxative misuse in an attempt to relieve discomfort. This highlights the critical need for careful screening and a holistic approach to care when considering these medications, especially in a weight loss context for vulnerable populations. The widespread use of GLP-1s is also having a tangible impact on the food and wellness industries. As users experience reduced appetite and make different food choices, their spending habits are changing significantly. Studies show that, on average, GLP-1 users tend to spend less on food overall, with the biggest reduction seen in categories like sweet and salty snacks and baked goods. There's a reported increase in spending on fresh produce and deli items, and a preference for foods with added protein and less sugar, salt, and carbohydrates. Consequently, sales of items like frozen foods and center-store beverages may see a decline among this growing user base. Beyond food, spending patterns are shifting in other areas too. For example, there's increased spending on drinkware and water filtration devices, possibly driven by recommendations for users to stay well hydrated and on gastrointestinal remedies to manage side effects. Conversely, as overall health improves for some users, there may be decreased spending on products like sleep remedies and analgesics. Fitness companies might see new opportunities, such as increased demand for specific types of workouts like strength training, which can be important for maintaining muscle mass during weight loss. Food companies are already beginning to adapt, with some introducing GLP-1 friendly product lines or considering smaller portion sizes. This shows a disruptive force at play, compelling various industries to innovate and adjust their strategies. Finally, the rise of GLP-1s brings several ethical considerations to the forefront: access and equity. These medications are often expensive, and insurance coverage can be highly variable and, in some cases, decreasing, particularly for weight loss indications. This creates significant disparities in access. It raises questions about fairness. Should individuals with diagnosed diabetes or severe obesity, for whom these drugs can be life-altering, be prioritized for access over those seeking them for more cosmetic weight loss, especially during periods of drug shortages? Medical need versus cosmetic use. The line between treating a medical condition like obesity or overweight with comorbidities and using these drugs for purely cosmetic purposes can be blurry. While drugs like Wegovy and Zepbound are FDA approved for long-term weight management, others like Ozempic are often used off-label for weight loss. The long-term effects and safety of using these potent medications for cosmetic reasons, especially in individuals who are not clinically obese or overweight, are still largely unknown. Long-term use and weight regain. GLP-1s are generally considered treatments for chronic conditions, implying long-term, possibly lifelong, use. Evidence suggests that if the medication is stopped, weight regain is common. This has significant implications for long-term healthcare costs, patient expectations, and the potential for a cycle of medication dependency. Resource allocation. The immense investment in research, development, and marketing of GLP-1s, along with the healthcare costs associated with their use, is substantial. This leads to broader questions about whether these resources might be diverting attention or funding from other important public health areas or interventions. Informed consent. It's crucial that patients are fully informed about all aspects of these medications, not just the benefits, but also the potential side effects, the likelihood of needing long-term treatment, the possibility of weight regain if discontinued, and the unknowns that still exist, especially regarding very long-term use. These societal and ethical dimensions are complex and require ongoing discussion among healthcare professionals, policymakers, patients, and the public to ensure these transformative medications are used responsibly and equitably. Summing it up and final thoughts. We've covered a vast amount of information about GLP-1 medications. Let's briefly recap the key takeaways. GLP-1s represent a truly transformative class of drugs, offering remarkable benefits for managing type 2 diabetes and achieving significant weight loss in individuals with obesity. They work through multiple, sophisticated physiological mechanisms, essentially mimicking the body's natural incretin hormones to help control blood sugar, slow digestion, and, crucially for weight management, reduce appetite by acting on the brain. We've seen an impressive evolution in this field, from the initial discovery and first-generation drugs to the highly effective newer agents, including dual-action medications, with even more innovation such as oral versions and triple agonists on the horizon. The efficacy of these medications is well documented in numerous clinical trials, with many patients achieving not only substantial weight loss and improved glycemic control, but also experiencing other important health benefits, such as cardiovascular protection and potential improvements in liver and kidney health. However, it's essential to maintain a balanced perspective. These powerful benefits come with a profile of common side effects, primarily gastrointestinal issues like nausea and diarrhea, and a list of important safety warnings and precautions that must be taken seriously and discussed thoroughly with a healthcare provider. This brings us to a critical point: the indispensable role of healthcare professionals. GLP-1 medications are not over-the-counter solutions or quick fixes. The decision about whether a GLP-1 is appropriate for an individual, which specific drug to use, the correct dosage, and how to manage any potential side effects, all require careful consultation with a doctor or another qualified healthcare provider. They are the ones who can assess an individual's complete health profile, discuss the potential pros and cons in a personalized context, and monitor progress and safety throughout treatment. It is also vital to avoid unapproved or compounded versions of these drugs and always use medication obtained through legitimate prescriptions from licensed pharmacies. The science and clinical application of GLP-1s constitute a rapidly evolving field. We are continuously learning more about their long-term effects, their full range of benefits, and potential new therapeutic uses. In final thought, GLP-1 medications represent a major leap forward in our ability to treat complex metabolic conditions like type 2 diabetes and obesity. When used wisely, under appropriate medical guidance, and with a full understanding of their characteristics, they hold the potential to significantly improve the health, well-being, and quality of life for millions of people worldwide. But like any powerful tool in medicine, they demand respect, thorough understanding, and careful, individualized management. Thank you for joining this deep dive into the world of GLP-1s. It is hoped that this information has been both informative and helpful. Please remember, this presentation is for educational purposes only and should not be considered a substitute for medical advice from your own healthcare provider. If this presentation was useful, please consider giving it a thumbs up, subscribing for more health insights, and sharing it with anyone who might find this information beneficial. And most importantly, if you have questions about GLP-1s concerning your own health, please make sure to discuss them with your doctor.